Good morning, good afternoon, good evening, wherever you are connected from. I'm very happy. It's so wonderful to have you all join us at this very special Youth in Action webinar. We'll give it a couple of seconds more until everybody has joined in.
Sorry, Sam, colleague from the main room said she can't hear, honey.
Okay, so again, welcome everybody. Good morning, good afternoon, good evening. Thank you for joining in our very special webinar for today. We're gonna have, before we get into this, let me introduce myself. My name is Haneen Aoude. I am a health advocate and a very proud member of the Global Governing Council of the NCD Child. NCD Child has been long working as a multi-country, multinational organization who has put people at risk or people living with NCDs rights, care, needs at the top of its mission priority, and has been advocating globally for people living with NCDs and at risk of non-communicable diseases, and that particular to the age group of youth, adolescents, and children. So again, I just want to make sure that we are having this live and translated both in English and French. Please go ahead and choose your preferred interpretation. Some of our speakers will be speaking in French and others in English. Because this is a very special year. In 2021, the world has celebrated 100 years of the insulin discovery. And this is a very significant time for the NCD space, as you know, and especially for diabetes. We have this particular discovery has advanced the lives of so many young people and people at large living with type 1 diabetes. And for this reason, it does mark a very significant milestone in organizations, for people, for a lot of advocates who are working globally on this issue. Yet, the world still has about 420 million persons living with diabetes. And this is not a small number. And, as you know, in 2019, diabetes was the direct cause of 1.5 million deaths, according to WHO study. So these are staggering numbers, and the NCD Child continues to contribute to the advancement and the movement globally to better care and voice out all the needs, rights of people living with NCDs. Earlier this year, there was a campaign launched, and many of you has been part of it, called Youth Beyond T1 D, Youth Beyond Type 1 Diabetes. And this was targeting social media, getting the voice heard for so many people living with NCDs. And, we've heard so many inspiring and amazing stories of young people who have taken their challenge, to a step forward and built some amazing initiatives. A lot of them have shared their stories from across continents, and we are very proud to have some of them join us here today. So you get to hear their stories, hear their the challenges they've been through, and share your insight, and hopefully this will pay forward in inspiring a lot of other people to follow suit and share their narrative. We've had 17 countries participate in this campaign, but it is our objective to reach out for as many people as there are around the globe. And of course, with today's webinar, we are very excited to be continuing this effort and, see how people with type 1 diabetes are positively changing the narrative around this disease. They are positively contributing, impacting not only their lives, but lives of their peers, of the society, and their families, and a lot of people who are taking these inspirational stories and triggering social impact in their own communities. Before we move on to our moderator, I would love to thank again Novo Nordisk for their contribution and for supporting this webinar and convening this webinar. The Changing Diabetes in Children program has been very generous to help us put this together. So I'd like now to introduce our moderator for today, Dr. Apurva Gomber. She's an NCD Child young leader from India. Apurva completed her MD in pathology, and she's currently pursuing her MPH, the Masters of Public Health, in the Department of Global Health and Population at Harvard T.H. Chan School of Public Health. Her interests to work in the field of non-communicable diseases and in the field of type 1 diabetes particularly stems from her own experience of living with T1D for over 13 years. She has been passionate about fighting against the stigma associated with the condition, and also advocates for the prevention and early detection of diabetes-related complications. She is also one of our 25 young leaders in the NCD Child Young Leaders Program. We are very happy to have you, Dr. Apurva, and I would like to thank you for moderating this session with us, and the floor is yours to kick off this session.
Thank you so much, Haneen. I hope everybody can hear me well. Okay, so hello everyone, and thank you for joining this amazing, very important discussion. I'm very honored to be moderating today's session with this amazing bunch of panel. And some of them, I had the honor to meet them in person when we had like past conferences before COVID happened. So I'm really honored that I am with them today, and I'll be moderating the session. So we'll quickly run through the agenda for today. As you can see on the slide, that we'll have introductions of all our panelists, followed by a discussion where they will be introducing themselves and their journey living with type 1 diabetes. We will have a Q&A session where I'll be asking them questions which the audience will be posting on the chat box. And then this will be followed by the closing remarks. So before I introduce our fantastic youth panel, I would like to cover a few housekeeping points. So first would be that today's webinar is being recorded. We will be able to share a link with you after the event is complete. We welcome you to visit the content yourself and share it with your colleagues. Second would be that we invite your comments and questions. Please use the Q&A chat function to submit your questions, and we will try to address all the questions as the time permits. The third is that the presentation today, as also mentioned by Haneen in the beginning, will be both in English with French interpretation available. So please click on the interpretation button located at the bottom column of your chat and click the language you would like to hear. Thank you. So now I will move to the session. For today's session, we have this amazing bunch of youth speakers that have joined us to talk about their journey with type 1 diabetes and how they are positively contributing to the community of type 1 diabetes. I would like to quickly introduce all our youth speakers, and then we'll provide a detailed introduction before every panelist comes with their questions. So we've got people from across the globe, starting from Rubia Alam from Bangladesh, Al Hassan from Guinea, Zanik Edwards from St. Lucia, Esra El Haj from Sudan, Bruno Hellman from Brazil, and Margaret Namalindwa from Uganda. So now I will be quickly, to kick off this discussion, I would first like to introduce Zanik Edwards. Zanik is from Helen of the West Indies, St. Lucia. She works as a special education teacher to students with multiple disabilities, most of whom have physical impairments and communication challenges. At the age of 16, Zanik was diagnosed with type 1 diabetes. And although she has a love-hate relationship with diabetes, which I think most of us have, her diagnosis continues to provide the impetus for her work in diabetes advocacy. She has served as the president of the Youth Diabetes Foundation for 5 years and has spearheaded several youth-oriented programs and support networks for children living with type 1 diabetes. Zanik continues to dedicate her life to being a representative voice for youth living with diabetes in St. Lucia. We are so honored to have you, Zanik, on this panel. Zanik, thank you for joining. You were diagnosed as a teenager, and living with type 1 diabetes can be very challenging, especially as a teenage person. Can you share some of your experiences and some of the solutions you have addressing and managing your type 1 diabetes since your diagnosis? Over to you, Zanik.
Thank you so much, Apuva. Good morning, everybody. Can everybody hear me? I hope that's a yes. Okay, so for addressing type 1 diabetes since my diagnosis, one of the things that I have done, which has truly helped me, was having informal peer-to-peer sessions, almost like support group meetings. We would have meets regularly where we had opportunities to discuss what it's really like living with diabetes and to see other persons like ourselves having the same challenges when it comes to food, when it comes to cravings, when it comes to dealing with different emotions like ourselves. And it was an opportunity for everyone to share their relatable experiences and to know that they're really not alone. Another thing that recently I started using YouTube as a forum to show everybody the reality of living with diabetes, because diabetes is more than just diet and exercise. So, you know, there's depression, there's sleepless nights, there's the different stages of grief, there's dealing with guilt for craving those things that, you know, they say we really should not eat. So it's a means where I get to show the invisible things of diabetes that we don't really focus on. Our focus is on eating right and making sure you exercise and making those things known. In terms of managing my diabetes personally, the first thing for me is support. Having a good, solid, grounded support system. And that goes beyond family, that goes beyond friends, also living with diabetes. that goes to establishing connections with different medical practitioners within the field, that will be able to guide you outside of the doctor's appointment, because you need the support outside of that 30-minute appointment. Of course, there's diet and exercise, which is difficult sometimes to maintain, but it comes back to support and having accountability partners who are able to contact you and be like, hey, you need to do your skips this morning, or hey, what did you have for breakfast, and so on. So for me, helping me manage and helping me deal with the challenges of diabetes, the main thing has been having a good support system.
Thank you so much, Zani. This is such a powerful message you just shared with your own experience living with diabetes. I think one takeaway message, which I think everybody goes through as a person living with diabetes, is that I always feel alone doing this alone. And you highlighted such an important point that that it's about support going beyond the boundaries of just family. And as we all can resonate with that, diabetes affects not just us, but our families too. So it's the support kind of has to go beyond, and we need that support to do it together in tandem. So we will be happy to share a video with Zanique has on YouTube, and we will be sharing it on the chat box. So feel free to watch the video as per your time allows. And that's a powerful video from Zanique's experience and her journey living with type 1 diabetes. Thank you so much, Zanique, and we'll have you again on the panel discussion.
Thank you.
So yeah, up next, we have another fantastic speaker from Bangladesh. That's Rubia Alam. Rubia is a young person from Bangladesh. She's currently a graduate student studying in political science at the University of Chittagong, Bangladesh. Being diagnosed with type 1 diabetes at the age of 8 and having gotten sick from it, Rubia believes that one of the most important ways for young people to manage their diabetes is to raise awareness of the condition and fight the stigmatization that surrounds diabetes. She's a member of the Changing Diabetes in Children program, and through that, she continues to contribute to the type 1 diabetes community by creating awareness through arranging screening programs at schools and assisting with the diagnosis of diabetes in children in her community. Rubia, thank you so much for joining, and I'm sure it's such an honor to have you here, and you're doing such fantastic work in Bangladesh. So thank you for taking out time from your busy schedule. And we know that you're busy with your family today with functions happening. So thank you so much for doing that for us. So I'll be asking you a question about your own journey living with type 1 diabetes, and how, as a person coming from a lower resource setting, how was it to fight the stigmatization that surrounds diabetes, and how that has helped you in your own diabetes journey, and finally empowering others in your community living with type 1 diabetes. So over to you, Rubia.
Thank you so much, Apurva, for giving me the opportunity to share my experiences. Good evening and good morning to everyone. Hope you all are doing well. Living with diabetes is a challenge we face every day. When I tell my peers that I am having diabetes at the age of 24, it was a astonishing thing for them. And my sister is also living with type 1 diabetes. So they think we are kind of two persons from another world. When we are not, we are from this world, and there are so many people like us in our community. But when we go to school or university or colleges, they don't know about diabetes, which makes our life more complicated. We have emotions, we have feelings, and when we have high sugar level or low sugar level, this makes our life more complicated. In the middle of the exam, I had an hypo, and people think that I shouldn't be here today. It takes only 2 minutes to cure a hypo. It's not a big deal. what is the problem with the people who don't know about diabetes? It makes the other people's life more complicated. So we need to create awareness programs from our house to the society, so that everyone can know that diabetes is a normal thing. It's not we are not from another world. We live here and it's a normal thing. We just need an extra care. So I would like to create awareness so that everyone knows about child diabetes or diabetes in young people.
Thank you so much, Rubia. That's such a powerful message you just shared. And as a woman from India and coming from a similar settings as Bangladesh, I can totally resonate with what emotions you're bringing about the stigma you faced as a woman and as your sister faced as a woman living with type 1 diabetes in a developing country like Bangladesh and India. Like you just highlighted such an important point that we are not from a different world. We are from here. All we need is just an extra hand and extra hand holding. So thank you for sharing that powerful message. And we are so inspired for all what you do, overcoming your own diabetes and also holding that hand for someone who needs it. So thank you so much for all the work you've been doing in Bangladesh. I will be now moving into the next speaker and I'll get back to you when we do the Q&A panel.
Thank you so much for having me here today. Thank you.
Thank you so much. So our next speaker would be we have our next speaker, third speaker would be Esra. Esra El-Haj is a youth advocate from Uganda and was diagnosed with type 1 diabetes when she was 11 years old. She's a member of the Sudanese Childhood Association, where she organizes marathons, educational workshops, entertainment activities, capacity building workshops for diabetes children, and was part of the Diabetes Educational School program for people living with type 1 diabetes. As a young leader in diabetes, Esra started a project called Sugar Sugar, which aims to educate and empower newly diagnosed children to help them manage and accept their diabetes. Being diagnosed with type 1 diabetes herself and being engaged in all those activities, Esra feels she was born to help other young people living with type 1 diabetes. That's such a fantastic experience, I think, Esra, you've been doing. Welcome to our panel today, and we are so excited to have you here. Can you share?
Thank you, Purva.
You're welcome. Can you share more about your project, which you started called Sugar Sugar, and how you got involved with the Sudanese Childhood Diabetes Association as a young girl living with type 1 diabetes since the age of 11, and how you've been getting involved organizing such fantastic youth-led initiatives, and how has that helped in growing the community and also your own personal journey with type 1 diabetes? Over to you.
Okay. Okay, thank you, Purva. Hello, guys. Greetings from Sudan. Actually, to correct Purva, I'm from Sudan. I'm so honored, as Purva said, to meet you all. My experience when I was 11 years old, a little girl diagnosed with such a strange disease that I have to change all my plans, my eating plans. I have to cut off sugars. So actually it was to some extent shockable for me. So I went to my first doctor who diagnosed me with diabetes, Professor Muhammad Ahmed Abdullah. He is our pediatrician endocrinologist here in Sudan. So he is the head or the president of our association. He encouraged me and he gave for me and my parents such an amazing support. So when I went to college, now I'm a medical student, he was one of the professors that teaches me. So he encouraged me to enter the association and participate in their work. And I entered the association and start work since 2017. Then in 2018, I become the head of the youth office in the association. So my sugar product is part of the project that I'm doing as a young leader in diabetes in the IDF in the International Diabetes Federation. So sugar aims to train children with diabetes or newly diagnosed diabetes to become future leaders and to help them to overcome and to understand their disease. Actually, I finished the first term of sugar, and the end result was amazing. The children who participated in our program, they give an amazing positive result, and they now they can speak out of themselves. They were afraid of taking injections, and they were very shy to do diabetes, for example, to test their blood glucose in front of people, but now they overcome all of those stigmas. So also that helped me to be a better example for them. That's why that's helped me to control my diabetes, to become a better example, because everyone who is every child who is engaging in our programs ask each other, what is your HbA1c, hemoglobin A1c. So it will be nice when they hear that your hemoglobin A1c is on the range, to encourage them to do better control and manage their diabetes. Also, our last program was success event, who we brought children who are successful from all over different areas, and they speak to our children who were chosen by our psychologists. They were, like, psychologically affected by having diabetes, so they talk to them and they encourage them, and also we have a positive result. So I think being engaged in diabetes related activity have helped me a lot with managing my diabetes and learning some new stuffs of diabetes. So my advice to all of you, you're great the way you are. Don't be ashamed of your diabetes. You are chosen to be an advocate and to be one that can raise awareness of our disease, and engage more in diabetes related activity and learn a lot about your disease, and give support to other diabetics in all over the world. Also, diabetes gave me a very amazing friends from all over the world. So I'm thanks to diabetes that gave me this opportunity to meet you and meet my friends. Thank you so much.
Thank you so much, Esra. That's so powerful, and I just feel the way you want to pop out of the screen. That's what the energy comes out when you meet somebody living with type 1 diabetes from across the globe. And thank you so much for taking our time and for the fabulous work you've been doing.
Thank you so much.
Thank you. And this is just one takeaway message which Esra pointed out. So I think I've got a chance to meet Esra at the IDF Young Leaders Program, and that was one of the programs where I also got motivated to start working for people with type 1 diabetes in the community, because getting diagnosed with diabetes is such a challenge, and it can be such an overwhelming period of your life that you need somebody's support. And I think with the initiative Esra started called Sugar, she's doing a fabulous job of helping the other people who are recently diagnosed to understand, to live their life just going beyond just HbA1c numbers, and telling them that there is a life possible by running marathons, by doing such fabulous creative work together, and also making amazing friends from across the globe, which I believe I've had, and I think I've had more friends across the globe than in my own country. So
yes,
that's been an amazing journey so far.
We're following your steps, Apurva. Thank you so much. You were amazing.
Thank you so much, Esra. So up next, we have an amazing speaker and an amazing, powerful advocate for type 1 diabetes, who's joining us from Brazil. No other than Bruno Hellman. I've had the honor to meet him in person. I've tried so hard to run marathons with him, but never got a chance to, but that's still a hope. So Bruno Hellman is a public health and a youth advocate from Brazil with special focus on NCDs. And he's also one among the 25 NCD Child Young Leader. Bruno is the founder of Running for Diabetes, which I mentioned. I've got a chance to meet him. He's doing a fantastic job with the Running for Diabetes nonprofit organization that he started in Brazil and promotes inclusion and health for people living with diabetes and their family members through regular practice of physical activity. He has also been involved in many other capacities of diabetes and NCD advocacy, such as working with kids and diabetes in schools, serving as a member of the PAHO advocacy consultant, and working along with the Brazilian Ministry of Health. This is such a huge honor to have you, Bruno, and thank you for taking out time, and welcome to today's discussion. I think I should stop talking now, but I would just address one question to you because you have a lot to share. Can you share with us a little bit about how you started the initiative called Running for Diabetes, and how are you supporting young people and their family members living with diabetes and also building up a stronger community each day? Over to you, Bruno.
Thank you very much, Apurva. Thank you to NCD Child for this amazing opportunity. I make your words my own. I hope we get to run together our marathon. So before I start, I'd just like to acknowledge how honored I feel to participate in a panel on which I am the only white male. This is something unusual in most of public health events, and just to be surrounded by really powerful voices, especially coming from women, non-color women of color, it makes even more special to me. So just resonating to what Rubia said about feeling that we are from another world, that's how Running for Diabetes started. I just felt that it was my responsibility to share with others and to spread the message that people living with diabetes could do anything that we wanted to. So it started as an individual project, as I say, Bruno-centric project, on which the idea was to me run marathons around the world. And after completing 12 full marathons under Running for Diabetes, I understood the importance of bringing more people and building the community, so we can not only spread the word for a larger audience, but also to make sure those people could also benefit from physical activity initiatives. So I would say that my biggest takeaway of all of this is that follow your heart and do what you are passionate about. Like I have never been great on arts and crafts or even dance, and like that wouldn't make sense to start a project on those areas. So I'm sure that you're good on something, and if you're not good like me, I'm not a good runner, but I love running. So just find something that makes your eye shine and get deep into it. So I think that's my key message, Apurva.
Thank you so much, Bruno. Your words always inspire me. And the way you said that do what you love and do something which makes your eyes shine and what you're passionate about. I think you're a living example of all of that. And your work in type 1 diabetes and for the community is so powerful that it has changed lives of people, not just in Brazil, but also people across the globe. So thank you for all what you do. So I think we had one more speaker on our panel who's having technical difficulties. So we'll not be having him anymore on the panel, but I'll be moving to the Q&A with the panelists. So if there are any questions, please, if you are still allowed to put it in the chat box so I can take in the questions and address it to the panelists. So thank you to all the speakers for sharing their empowering journey living with type 1 diabetes. We will now open the discussion for the Q&A session. So please submit your questions if you haven't yet. I just wanted to run over all our speakers and just wanted to walk back into every speaker that has shared that diabetes can be overwhelming. Diabetes can be a challenge each day. And what connects us from being from people from across the globe is diabetes, and that's brought us together. So one of the questions I want to address, and I think each speaker here pointed out that they've been doing something for type 1 diabetes to improve lives of children living with diabetes and youth living with diabetes through support groups, through running initiatives, and through community-led programs like Sugar Sugar by Estra. So my question would be first to Zanik, would be what is that we are aspiring to achieve in the realm of type 1 diabetes advocacy, and how would you define success in type 1 diabetes? Like, what do you believe like we've achieved good care? Over to you, Zanik.
Thank you, Apurva. So what are we aspiring to achieve with type 1 diabetes? Prevention is the first thing altogether. And recently during COVID times, we've noticed that, more children are being diagnosed with diabetes, type 2 diabetes. So something is wrong somewhere, and we need to work towards that. Another one is proper management to avoid those diabetes complications. That's a win for me. If we can avoid amputations and we can avoid eyesight problems and different complications that come with diabetes, that would be a win for me. So right now we're working towards preventing, for example, childhood obesity, right? So we aiming to work with the different schools and so forth in St. Lucia to help prevent childhood obesity. Like, what can the kids do at home right now? There's very little we can do. There's very little we have control over because we're not actively in school, and persons are more sitting down at home and watching television and stuff like that. So the odds are against us, but we're out here working. The Healthy Caribbean Coalition recently created a policy brief, which is geared towards the Caribbean region on a whole, where they target 4 main things, which is which is prevention, and they focus on childhood obesity. Another one is treatment. That's another very important win, getting insulin and different technologies available to persons out here in the Caribbean, which can be hard. Some of the technologies that are available around the world are not yet available in the Caribbean. So that would be another thing I would consider, I would aspire to. Here.
Thank you so much.
That's
really true, Zanik, that I think diabetes, so when we talk about insulin access, that's just one piece of the puzzle, and diabetes as a whole is so complicated that we need to fit everything in the puzzle in the right way to achieve success. So we are way behind achieving care for everybody globally, but we are striving for it and we are fighting towards it. So thank you so much for sharing your experience. And I know prevention of type 1 diabetes is difficult because sometimes we cannot prevent the autoimmune destruction that happens in the body, but we can early detect diabetes. We can prevent a child from dying just because of undiagnosed diabetes. So that's such a powerful message you shared, that that would define success for you, saving a child from dying just because of not getting diagnosed at the right time. So thank you so much for doing that. My next question would be to Bruno. And I think Bruno has been involved in a lot of diabetes initiatives happening with WHO and with other Ministry of Health. So you know that Global Diabetes Compact is on the roll, and with the 100 years of insulin discovery and a lot of advocacy work happening around access to insulin, and also ensuring that we improve the care of type 1 diabetes globally, also in getting correct data and evidence-based research from countries like in developing countries and also developed countries. What should we do different and how things are developing with the Global Diabetes Compact? And if you have anything to share with us on how we can improve what we are doing with diabetes care clinically and also through effective advocacy. Over to you, Bruno.
Thanks, Apurva. This is a really tricky question. I see with good eyes and open heart all the effort that the WHO team, especially the global coordination mechanism on NCDs, led by Dr. Bente Mikkelsen and her team, have been doing in order to promote meaningful involvement of people living with NCDs, especially diabetes, on creating mechanisms and recommendations to the country level in order to, as you said, not only prevent but also improve the quality of life of people living with diabetes. So I believe that our role as advocates is not only to engage and replicate all the documents and all the recommendations that the WHO has been putting into place, but also try to bring those formal treaties, those formal agreements to our reality. We need to start working on the ground and making sure that the top level decisions resonate on our day-to-day challenge. So I would say that all of us, either living with diabetes or only public health advocates, we should get those documents and start pushing our ministries, our secretaries of health, and not only health, like education. We have the example of the IDF Kids program. We have other examples in terms of like the nutrition and the agricultural ministries, and why not human rights ministries and so on. So I think it's our duty and responsibility to call upon them and to demand change. Otherwise, the change won't be delivered to our hands. Like for them, it's great the way it is, because when we demand change and for things to be changed, it demands a lot of work, it demands a lot of dedication, and sometimes even extra budget. But in the end of the day, this pays off, because if we invest on providing the best quality of life to people living with NCDs and people living with diabetes, we'll be saving money on dealing with complications and dealing with extra costs that are way bigger than treating diabetes.
Thank you so much, Bruno. And I think you highlight a very important point, that holding our government and our ministry accountable for ensuring that people with diabetes are heard and they're like we get better care is not just our duty, but also our responsibility, because we are the voices and we are the people who can advocate for our own condition, living with diabetes, because we know how challenging it can get with diabetes. So thank you so much for sharing your experiences with diabetes advocacy. I just have a follow-up question, and I'm just curious, and that's why I'm addressing this question back to you, is how can, so it's not easy to advocate for type 1 diabetes, knowing the politics and hierarchy of how the government system works. How can a young leader or a person living with diabetes, how can he get involved, and how can he or she start doing advocacy. And it's not just about shouting that, oh, I have diabetes, but how to do effective advocacy. So I would like you to point some tricks and tips for our viewers here. Over to you.
Okay, so there's this quote that I like a lot, that it says, if you think you're too small to make a change, try to sleep with a mosquito in the room. So I think, as you said, it's not just a matter of making noise, but making a coordinated noise. You are not a lonely voice within the community. In some times, unfortunately, but for other times, fortunately, there are like millions of us that share the same challenge and share the same experience. So I think the first step is try to converge those narratives and to join forces. People tend to think doing advocacy, it's a matter of who shouts louder, but I think it's a matter of who shouts stronger. And in order to shout a stronger noise, it's a matter of convening forces and combining efforts. And the second tip that I would give is try to make the change from inside. I know that's not always easy, but the way that I was able to kind of push forward advocacy plan within the Ministry of the Health Ministry of Brazil was that I managed to get a consultancy role within the ministry. I'm not saying it's easy, but also I think it's a matter of trying to find a way getting into the game and becoming an active peon on the table. So to sum up, first, don't try to start and reinvent the wheel, join forces and manage to bring together the different voices. And second, try to understand what are the different opportunities and what opportunities can be created within the actual framework.
Thank you so much. And I think that's a lot of work from your experience you're talking about. I think there are many people who would want to get involved into advocacy. So a piece of advice would be just start doing it and don't think about it. I think get in touch with people in your community, build up a stronger community and hold your governments accountable, because I think there are a lot of people who keep it in store and don't want to change because they just accept how things are. And that's where we all get laid back. So it's important that, as Bruno pointed out, that we as people with type 1 diabetes need to voice our voice, not just for ourselves, but it's our duty and responsibility to keep our health systems accountable for providing better care and saving lives each day with type 1 diabetes. Thank you so much, Bruno, for that. Now, as holding our health systems accountable is one of the most important pillars when we talk about non-communicable diseases and ensuring that we have better care for everybody globally. I think that's one piece of the puzzle, but having support, as each member of on this panel pointed out, that getting diagnosed with type 1 diabetes is so difficult. And Zanik pointed out that feeling alone and not having the support with diabetes can be very challenging. So my question would be that to Esra now, that why is youth engagement and advocacy important in helping people with type 1 diabetes? And why did you think of starting Sugar, like you pointed out, that you had to go through a lot to finally decide that, oh, I would do a lot of marathon activities, engage the community, start this. Why do you think that's an important piece in the diabetes puzzle? Over to you, Esra.
Okay, as in my experience, I went to in 2019 to an advocacy camp for diabetes in Ethiopia. So one day my sugar wouldn't be less than 400, and it turns out that there was a plug in my pump. I didn't know it at first, and I gave correction, and it still was high. So I started to cry. This is the first time I cry from the hypers. So my friends, all of my friends were diabetics. They hold me and they support me, and I was crying, and they were like tapping on my shoulder and say, "It's okay, don't be afraid." Then I felt that I need that, and I felt that I think everybody could need that, especially the newly diagnosed. So that's why I started I think about the initiative Sugar, not just to train the children of being leaders, but to give them support and to tap on their shoulders and to say for them it's okay to have hypers, it's okay to feel bad, it's okay to not being able to manage or control your diabetes. You can try harder, and I'm here, and we are here. We were just a team. All of us are diabetics. That organizing the Sugar program for the children. Even when we are on the vaccines and we do the organization stuff, and some of us feel hypers, we give them support. So I think support is a very, very, very important puzzle. Every time when I feel distressed, I think about why me? Why me to have diabetes? And then I realize that I need support. Whenever I got this support, I feel better. So that's why I think seeking help and seeking support and understand my disease best, it's the best approach to manage and control the diabetes.
Yeah, thank you so much, Esra. That's a powerful message that you laid out, that sometimes you need, like, even if you want to be the strongest person in the room, sometimes you need someone's shoulder to lean on and to tell you that, hey, you got this and you can do it. So thank you so much for the amazing work you've been doing with Sugar. And like you pointed out, this is where the advocacy starts. When you start advocating for your own condition, like by when you get newly diagnosed, you get the support from somebody. That's a chain reaction. You take it forward, and then, as Bruno pointed out, these are the future leaders who advocate and hold their governments accountable. So it all starts from hand holding, and then making that chain reaction really strong. Thank you so much for that.
Thank you.
My next question would be to Rubia, and I think this is a very important question from Rubia, from your perspective and from your sister's journey with type 1 diabetes. That like, as a person living with diabetes and coming from a developing country like Bangladesh, what do you think and how do you suggest we could do things better in engaging the youth, fighting the stigma, and also ensuring that there is inclusion when we talk about diabetes? It's not just about diabetes is different with men, or diabetes is different with females, but how can we ensure we do better for people engaging, for people with diabetes, engaging them, building a stronger community, and ensuring there's diversity and inclusion in diabetes care? Over to you, Rebecca.
Well, we can all see there are smoking zones, but there is no way we can take insulin safely in a public place. So when I was asked that what change I should bring in the society if I can, I said I am going for a room to take my insulin safely. This is my first concern, that I won't go to the washroom to take the insulin. It is not hygienic. And whenever a newly diagnosed parents came to talk to me, that they said, if is my child, is can he take sugar or can she take sugar when she really likes chocolates, can I give it to him or her? I said yes, why not? She can eat chocolate, or he can eat chocolate anytime, but you need to measure it first. We need to educate them with carb counting and managing diabetes. It's not like we can't eat anything or we can't do anything. We can do everything and we can eat everything. It's hard to manage diabetes, but it's not impossible. And there are so many superstitions we heard every day. When I was first diagnosed, all my relatives were saying you should drink the juice of bitter gourd every day to manage your sugar level. And I said it's not same as your aunt. To make sure that my one is not type 2 diabetes, we can adjust the sugar level by taking insulin and insulin only. I am dependent to insulin. You have to understand that I have to take insulin. There is no other way. So I think the awareness is very important because people know about cancer now. People know about uh, COVID now because of the awareness programs, and there are not sufficient awareness program about diabetes or young diabetes or diabetes in children. So I think for the developing countries, and even in the developed countries, people don't know about diabetes very well. They said eating sugar makes you have diabetes in age, but it's not related to eating sugars, right? You know it better, and we all know it, but the we have to educate people about it. I think this is where we lack.
Yeah, thank you so much for sharing that. I think you bring about a very powerful message about the stigma and the myths and misconceptions that revolves around childhood diabetes. Uh, and that's one of the reasons why we are not able to diagnose diabetes early, because some people land up in complications and ultimately die of diabetes, not knowing that they actually had type 1 diabetes, is because they cannot overpower those myths and misconceptions with
I can
diabetes care.
actually add something here. When I was diagnosed, I was almost died. I ended up in coma. But when it comes to my sister, with his first symptoms, I said we should check her blood sugar level. And here comes it, 24 after eating a meal. So it's easy when we know about the symptoms. My family wasn't aware of child diabetes before. Why? Because they don't have enough education or enough awareness program earlier.
Yeah, thank you so much, Rubia. And I think I come from the similar uh, perspective of diabetes care, because like in India, like diabetes is so diverse, and so is in Bangladesh, because as a woman living with diabetes, it is so challenging to overcome those misconceptions that, hey, diabetes happened to this girl. First, to overcome that for your family would have been such a challenge, and then since they did not have the awareness on what to do, how to do, there is no information about what to do, and acceptance of initiating insulin for life is very difficult. So I think that's a very important thing you pointed out, that we need to overcome those myths and misconceptions and increase awareness about diabetes, like you pointed out, for cancer, for COVID. Why we are talking about COVID so much? Because there is awareness now about it. And if we talk about diabetes in a similar manner, we would be able to save so many children from getting diabetes complications and preventing these complications early. And also providing them a better support so they can live a near normal life, like everyone on the panel pointed out. So thank you so much for sharing that. I think there are a few questions that have popped up in the chat box, and I would now shift the lens from diabetes care at a personal level to a ministerial level to now how you can live beyond your diabetes through youth-led initiatives. So Mike, there's a question for Esra. As you've seen, most of them have been doing a lot of youth-led activities. So there's a question from Tino Tenda for Esra, saying that as an advocate who's running a project under IDF, do they offer your support through financial support or through any other resources during the course of your project when you started the Young Leaders Project of Sugar Sugar? Also, Esther, you mentioned about running a project which has succeeded. There are also times when sometimes you don't succeed in whatever you want to do. So if you can share some tricks and tips about how to do effective projects and how to get involved with the IDF Young Leaders Program.
Do you hear me, Apurva?
Yes, I can. Yeah.
Okay, thank you. So for the first question, the IDF doesn't support the project financially, but the support is by giving us the resources and the materials for diabetes education, and they give us also sessions and trainings to become a better advocate, to being able to get your own fund resources, and being able to run a project or manage it. So no financial support, but there is other than that, and I think it's more important than the financial support, which is the trainings and the materials. The second question, which is the successful, and we've run a lot of activities other than sugar in our association. Some of them didn't work, or some of them didn't work maybe because of we have some of security disturbance in our country. So, and also our our transport is difficult here. So we got problems for people reaching our place, or also if we want to do an online campaign or an online training or an online workshop, the internet connection also is bad sometimes. So those all are the difficulties that we are facing, and that makes our programs sometimes not succeed. So I hope I answered the questions.
Yeah, thank you so much. That's definitely really powerful. And I think there are times that even if you want to achieve a particular project, you want to improve diabetes care in your country by setting up diabetes camps or maybe some youth initiatives, sometimes you don't achieve what you want to do because there are a lot of barriers to it, dealing with the community's acceptance, creating that now I think with COVID, it's become even more difficult to engage the community doing these diabetes camps and activities. And also financial aspect is such a crucial piece because you need support in carrying out such activities. So definitely that's one of the reasons why Young Leaders Program by IDF was started, to give you that toolkit to better prepare you as youth advocates. So get involved with your IDF national communities. I think there are IDF-led initiatives in every country they are involved with. And so get involved with your diabetes association and national diabetes associations. And they'll be able to help you to do a lot of youth activities. And that's how you kind of like build upon it by using that toolkit. Now, coming to the challenges and the reason why I got involved in global health, because I definitely agree that diabetes exists everywhere. Diabetes challenge is so unique in every country. That's what makes diabetes such a complex disease to manage, because we all come from different backgrounds, different cultures, different mindsets, different myths, different misconceptions. And now combining all that to achieve a target A1C, to achieve better glycemic controls and preventing complications is what motivated me to do global health. And I just want to bring an important message that was taken, that was shared on the chat by somebody from Burundi, where diabetes is so difficult. And there is a person called Professor Francos. He shares his own experience with type 1 diabetes. And I don't know how many of you know about this place called Burundi, but people with type 1 diabetes have so much challenges there. And he shares that he started the screening programs and campaigns monitoring the access to diabetes care, and he identified 123 children living with type 1 diabetes from different districts, doing that mission to identify these cases, because a lot of kids were dying in Burundi with type 1 diabetes. And these were children from 6 to 25 years of age who never knew about diabetes before they came across Professor Frankos. So thank you so much for doing what you do, Professor. And that's an amazing, powerful message you shared, that because diabetes is everywhere in every country, it's just about us to identify it and provide provide better care to these children living with it. Thank you so much. Now there's another last question which I want to address to anybody on the panel, and whoever wants to take this up. What advice would you have for families of children with type 1 diabetes who are still in denial and who are not yet accepting type 1 diabetes? So anybody who is willing to answer this question, you can just unmute yourself. That's a very powerful question. How to overcome denial with diabetes?
Okay, I can give it a try. Since
Okay.
it's not a easy question. In the end of the day, people don't change unless they want to. So I think what we as community could provide them the channel, could provide them the path needed to that they don't feel lost, that they feel that they are not the only one in the world, that they can deal with it with support of others. So I would say that the first advice is to try to respect their own time. I know sometimes it's really hard and make us to kind of grab the family or the person by their arms and like kind of pushing them to the Diabetes Association or making them to engage with the community. But in the end of the day, it's up to them to navigate this path. So what we can do is to provide the resources, is to provide the environment, is to provide an inclusive environment. But in the end of the day, I think it's about respecting their own process of acceptance.
Yeah, thank you so much, Bruno. And sharing from my own personal experience and just adding to what Bruno said about diabetes acceptance. When I was diagnosed with diabetes, I was in denial for a very long time. And I was diagnosed as a teenager. And it took me almost 6-7 years to finally accept. I was so reluctant to even inject insulin that when I used to land up in ketoacidosis, is that when I realized it's me who has to accept it. Nobody else will force me to do it. And the sooner you accept it, you are able to change it. You can only take action when you know there is nothing you can do right now to completely avoid it, right? You can only get better from this, and you can only improve it from where you are right now. So I think it took me a long time, but I would just give a piece of advice to families who are still in denial, is that reach out to other people, like such powerful advocates like Bruno, Esra, Rubia, and Zanik. Reach out to people in the community who have had experiences living with diabetes themselves. They will help you. They will help you transition from that phase of denial to finally acceptance easily, because you can do things better together and more effectively, because more minds on a particular condition would really help you give a different perspective about managing diabetes and living each day much more empowered. So I would like to now open the panel once again to every speaker. I would go about with one by one. What is one step you want to take now, seeing COVID-19 happened? the NCD care kind of like went off board. So many people had challenges dealing with diabetes and also dealing with COVID care in their country. A lot of people couldn't even access insulin in their country, and things went off board with that. So I would like to put this question to everyone on the panel, starting from Zanique, that what is one thing, what are your next steps in the coming year? How do you want to improve diabetes care in your country? And what would be the tips and tricks for you, for somebody to get involved in your community, and how to reach out?
Thank
So
you.
the 3 questions in one.
Say the 3 questions again, please.
Okay, I'll go one by one. First
Okay,
would be, what are your next steps in the coming year, seeing the challenges with COVID-19 and diabetes? Let's address that first. Yeah.
Okay. In the coming year with diabetes in St. Lucia. So right now, I've already started, there are a number of projects actively going on right now. One of which is I started with a club before COVID, we tried to have a diabetes camp, which is, by the way, what brought me to my point of acceptance and a camp. And because of COVID, we're not able to do it. So in the coming year, our aim is to figure out a way to do that with COVID protocols in place, virtual if possible. You know, how can we impact these newly diagnosed youth living with diabetes without all having them in that one area, which that takes out from a lot of it. So that's one of the things. Another thing is to continue working on the childhood obesity program, get towards reducing childhood obesity in St. Lucia. And we're targeting schools. So we're currently working on getting that project off the ground, where we're getting certain students, certain age and grade levels involved in doing physical activities at home. And we're trying to figure out, how do we make this fun? Because, I mean, kids don't want to exercise. So they want to be on their tablet and do fun things like that. So how do we incorporate the tablet and the fun aspect of exercise to get them off the couch and so forth? What is the other question? Oh, and one more step moving forward is to try to make it accessible for CGMs in St. Lucia, or even in the Caribbean on a whole. So as I was telling you, it's not available in St. Lucia. And I had to travel this summer to the US to get a doctor in the US to prescribe it, so that I could have gotten on this device, which is not practical and realistic for majority of the St. Lucians out there. But it is a device I know that they would love to get their hands on. I mean, that device is a game changer.
Yeah.
So yeah, these are my steps moving forward.
Yeah. Thank you so much for that. I think, and wish you all the luck for doing the advocacy work you're doing for CGM access in your country. So all the luck. And if we can be of any support and provide you any assistance with it, we'll be more than happy to do it. So thank you so much.
Thank you so much. Thank you.
So moving to next would be to Esra. Similar question. What would be your next steps for the coming years, seeing the challenges of COVID-19 in your country, and how diabetes care went off board? So how would you see yourself doing what you do with Sugar and other initiatives in line in 2021 and 22?
Okay, as I said, when COVID-19 came on board, the people rely on internet to get their learning about COVID, and there was less physical activity and so on. So I'm trying to improve our online education in the association. And I made a little bit change in my Sugar program. One of them is in a state of coming physical. Every session, I will do the lectures online by recorded video online. And then there will be one day meeting every month you know, like to revise what was mentioned in the lecture, and to engage and to practice what have been mentioned. Also, one of the ideas, or one of the projects that we are working on, that engaging children in activities other than diabetes education, like learning electronics, like learning the sustainable development by the help, with the help of other organizations, and by learning, for example, painting and doing and other entertainment activities, because our organization have like a center, diabetes center for children, and we do all our activities there. So they are afraid that the same place that they learn about their disease and they take injection, they kind of have some fear in their heart. So we want to break that by engaging them in other activities than diabetes education, than taking medications, than you know, going to the lab and taking blood and so on. So we're already begun one term that we engage them, we engage one of our children in a lot of entertainment program, and develop their communication skills and develop their knowledge skills. So this is our next steps to improve that more.
Thank you so much. And I wish you all the luck for the coming year and for all the advocacy work you've been doing. Thank you so much. So similar question now over to Bruno. What do you think should be the next steps lined up for you in Brazil, and whatever advocacy work you've been doing with IDF and other initiatives, taking into consideration the impact of COVID-19 in diabetes?
Well, I cannot mention how much COVID-19 impacted the community of people living with diabetes, not only in Brazil but also worldwide. I have seen an accountable number of new cases, like there has been a significant increase of cases of type 1 diabetes after the infection by COVID, by the coronavirus. So I would say that the key advocacy priorities worldwide is to guarantee that all the movement that WHO has been leading globally to guarantee that this is applied in the local level, and this will be transformed and replicated into actions that will benefit those living with diabetes. Regarding Brazil specifically, I would say that now more than ever, it makes really necessary not to invest only on providing medical supplies and medication, but also to guarantee that the healthcare professionals are aware how to manage and aware of the holistic treatment that requires to look after diabetes. On the Ready for Diabetes Institute level, I foreseen the next year with the opportunity to scale up our impact, and also to build partnerships around the centenary of the first successful dosage of insulin. So honestly, I just hope and wish, not only for Brazil, but for every single country and every single person living with diabetes, that the next couple of months and the next couple of years are better than the ones that we have gone through.
Thank you so much, Bruno. And I wish I could close that with what you just said, that I hope the years that are coming ahead should be better than the ones we've had before. So, and I think that what makes this year even more special, with marking the centennial year for discovery of insulin. And that's what makes it more powerful for bringing youth advocates like you on this panel to share about how we could do things better in the years and how COVID-19 exposed the fragile health systems in our country and how we can do diabetes much better and much more effectively in our own respective countries. Thank you so much, everybody on this panel, for sharing such insightful messages and sharing such emotional stories and journeys living with type 1 diabetes. Now, with less than 5 minutes, I think, left on this session, I just want to say that whoever's watching this session, it's important as a person living with type 1 diabetes and also as a caregiver for somebody living with type 1 diabetes to, as the hashtag says, youth beyond type 1 diabetes. It is your responsibility, it is your duty to not just take care of yourself, but also somebody who's still struggling with type 1 diabetes by getting involved through youth initiatives, through support groups. There are people who are living with it and who want to get involved. So get out of that stigma, get out of that myths and misconceptions, get involved in your community. There are so many powerful advocates in each country like we have on this panel. So get involved with them, get involved with your National Diabetes Association. And that's where the real work starts. So good luck to everybody on this panel. Thank you for taking our time. You can find more information about the hashtag Youth Beyond Type 1 campaign started by the NCD Child on the NCD Child website, which is ncdchild.org. So thank you so much for watching. And I would like to hand over to Haneen for the closing remarks. Over to you, Haneen. Thank you so much.
Thank you, Apurva. This was amazingly moderated, and I would also like to join my voice in with you on the information and also share the email by which people can get in contact with us on ncd.child@sickkids.ca for any questions and following through. You know, it was really hard for the board for us selecting such inspiring stories to be in the webinar today. We've received 60 from 17 countries. And I cannot start to tell you how inspiring and how many people are really creating a lot of change. So it's been really, you know, heartwarming to hear the stories from Isra, Bruno, Zanik, Margaret, Rubia, and you on how much you know, effort there has been made, how you are getting up and bulldozing your way through it all, actively contributing to the type 1 diabetes community and the NCD's community at large. You know, a lot of people who are watching today or who are within our countries, systems, institutions, etc., can, you know, relate to such you know, stories and challenges. So, you know, I would really like to, you know, we heard about advocacy, accountability, support, but I would really like to end this session with one of my favorite writers, Charlie Mackesy, which really resonated well with all what you've been saying, our youth leaders. When big things feel out of control, just focus on what is under your nose. And the bravest thing people can say is help. People with diabetes, that's my change on the sentence, can be scared, but we are all less scared together. When you can't see your way through, see your next step. Just take that. We have a long way to go, but look how far you've come. And lastly, being kind to ourselves is one of the greatest kindnesses out there. So again, thank you all. Thank you for the audience. And before closing out, I would like to bring your attention to NCD's Alliance launch of their second video series, also called Facing Forward. And this is another 25 short films about NCDs that you can find in NCD Alliance website and pages. So again, thank you, Apurva. Thank you, our youth leaders, and thank you, the audience, for tuning in and being part of this very inspiring 1 hour and a half. Thank you.